We know that there's a shortage of mental health. We know that about 40% of people who need mental health services don't access it or don't have access to it. And so we want to make sure that people have access to mental health services. So if we had more of that support, then people may be stronger, may be more capable of thinking about some of the other things that are on your list.
Hello, and thank you for joining us on When Neighbors Talk. I'm your host, Dana Tucker Davis, and here is where our community will come together to discuss current events, the ways it impacts us all, and the solutions to the problem. Welcome to the neighborhood. Let's get into it. Today we will discuss health and wellness, but mainly how our city can help improve the health and wellness of its citizens. And I want to talk to you today about that with our first neighbor, and we're going to let her introduce herself to you.
Good morning. My name is Neena Smith-Bankhead, and I work with Emory University. I'm the director of our Encore Center at the Emory Centers for Public Health Training and Technical Assistance. I've been in the field of public health for more than 30 years now, so that's definitely my passion. And I relocated here in 1996. And so I think I'm officially a Georgia Peach at this point.
Okay. So what does Encore stand for? What does it mean?
Encore stands for Engaging Communities and Organizations Ready for Excellence. And so we're one of the 6 centers at the Emory Centers for Public Health Training and Technical Assistance. And so we work with organizations to build the workforce capacity in public health. We also help organizations develop various community partnerships and to work on their organizational infrastructure, primarily focused on health-related organizations.
Do you have direct contact with actual persons in the community, not just companies?
Most of our work is directly, at this point in my career, most of our work is with public health departments, but we also work with community-based organizations and support community-based organizations that are directly reaching into their communities to provide services and support. Sometimes we actually work with the organizations as well. So I wear a number of different hats, and so in other spaces I do work directly with community.
Oh, wow. Okay. And so is the focus mental health and wellness, or is it a particular area?
So through Emory, we work on across health issues. So we may work with organizations that are trying to build their services for HIV prevention and care. We may work with organizations that are working on diabetes prevention and care programs. We may work with tobacco awareness programs. So we pretty much cover a broad spectrum.
Oh, wow. Okay. So right now we're in 2025 and there's so much going on. People in the newer generations are focused on self-care.
Yes.
And, you have persons my age who are embracing and openly talking and seeking engagement about perimenopause and menopause.
Yes.
You have this new hyper awareness of issues that impact our mental and our physical being, as well as some things that are emotionally going on. There are job losses,
Exactly.
the thought of deportation or removal of kids and family members, financial instability because, people are talking about not being able to afford their housing or having to move somewhere else for a job in another place. So the stress that comes with that. So with all of that going on, we want to talk to you about the partnerships and collaborations, things you've seen here in this state, and how we can better help our neighbors as they navigate these issues. So that's what we're going to talk about today.
Awesome.
And so when you talked about diabetes, I will tell you I am diabetic. I go in between diabetic and pre-diabetic because sometimes I like pasta a lot, and sometimes I can refrain from it. So, it vacillates. So anyway, let's start with some statistics that we have. And it says in 2024, Forbes listed Atlanta as number 14 out of 20 of the least healthy cities in the United States, with a high percentage of residents reporting heart disease, diabetes, there it is again, and high blood pressure, which I also have. Well, technically I have heart disease as well. So everything you're going to say today is for me and my immediate family because we hit all three of these, right? Alternatively, Wallet Hub, not Forbes, reported that Atlanta is in the top 20 of the healthiest cities in the country, with strong marks because they're looking at food intake and selection and diet and then nutrition, and they're looking at fitness and green spaces. So they're looking at outside factors that help. So who has it right? Or Forbes or Wallet Hub, or are we talking about some combination?
So I think it's probably some combination. I'm going to go with combination.
Okay.
And I just want to say, as you talk about the things that you're living with, I think so many people are living with a combination of all of those health issues. So I'll start with, I do think that when we think about the infrastructure of the city of Atlanta, some of the things that we have going on really, really well in the city of Atlanta, we do have a lot of green space. A lot of our communities have local parks, for example, and playgrounds. And we do have awesome healthcare resources. We do have really great options for food and healthier foods. And in some neighborhoods, we do have a lot of programs that support food distribution, especially a renewed focus in living food or food that's, not processed. So we are having those conversations more. So in that sense, I do think that the articles are correct, that Atlanta does have a lot of amazing resources that can really help our communities. However, I do also think that there are some challenges that we experience, not just in Atlanta, but across the state, where in some parts of the city and parts of the state, transportation is a challenge. So if people can't get to those resources, they don't necessarily have the benefit. Higher rates of many states of people who lack insurance. So again, even though we have some of the best health care, if people don't have access to that health care, they're not necessarily taking full advantage. So I do think, and then of course, food choices is really very heavily based on income. And so what do you have the money? What money do you have and what can you afford? What's in your community? What's accessible to you? So I do think that Atlanta, although we have really great services, really great access to be healthy, I do think there are some determinants of health, some things outside of our control that may have an impact on people's ability to take advantage of those things.
So the infrastructure for healthy living and better mental and physical wellness are present. The opportunity to get to those and utilize them is what's lacking, right?
Yes. And I will say, and I didn't speak about mental health, but we have a lack of mental health resources across the country. So that's not unique to Georgia or any other state. And so when we talk about mental health, there is an overall deficiency in the number of resources that are needed compared to the number of people that could benefit.
Because it looks like Ford focused on physical ailments, heart disease, diabetes, blood pressure, things that can be measured with some form of a test, right? Whereas a lot of times the diagnosis and treatment for mental health issues aren't as clear cut as that,
Exactly.
And so perhaps you are correct that there's a combination.
Yes.
But so you have food deserts, you have homelessness, and you have all of these things. What agency efforts are best available for us to improve our health and wellness here?
Yeah. Well, fortunately in Atlanta, we do have a number of community-based organizations. We have our health departments that are very engaged in community to some extent. But we have a number of really strong community-based organizations that really understand the needs of their community. And what I think is really promising are the number of community collaborative efforts that are taking place across many of our cities. So we have agencies that work on homelessness, for example, that are partnering with agencies that focus on testing and screening and things like that. We have agencies that work on HIV prevention and care that are also very engaged in the housing issues that are happening in communities. So I think we're starting to see, we're even seeing local government get involved and help to sponsor health and wellness events, health and wellness walks, and bringing vendors out to do screening, to bring food distribution programs out. So I think we are seeing a lot more collaborative efforts.
Now, I have
and that's
witnessed that.
healthy.
I have witnessed there have been more, and they do it, and maybe it's cyclical, but some cities, Atlanta, South Fulton, I know there's some in the Cobb County cities that are having these festivals that really are covering for health fairs. You know, they will have presentations or tables, vendors that offer exercises, and they're all unique. I went to one, and it was really supposed to be a voter registration, but they had an exercise company that was there that had these little robotic, like little things you bounce off of, and I'm not coordinated enough to do that, so I didn't try it. But so again, it shows that there are things here for Atlantans in the metro Atlanta area, or even Georgians that are addressing this. But so if I had to give you a list of things, can you tell me which one is the most impactful on the health and wellness here?
Yeah.
So one would be access to basic needs. We're talking about food and water, shelter, availability of green spaces and fitness avenues. Is that high up, low up on the impact? Access to routine health care and proper diets. They go together. And then the growing mental health challenges that we have. If you had to rank those four, you talked about all four of them, but if you had to rank them as which one is the most impactful on the health and wellness of the Georgians, which one would you say is the most impactful?
That's a great question. Let's see. I can't pick two.
Okay.
Let me pick two. When we think about people focusing on their health and wellness, I think we have to remember that, the order of priority are take care of our main needs first. So, of course, food, housing, and shelter. Those are always critical, right? If people don't have access to those things immediately, it makes it really difficult to focus on some of those other things.
So if you don't have anywhere to stay, you're not worried about going to the green spaces to lay out and do yoga.
Exactly. Okay. So if you are homeless, if you're struggling to keep housing, if you're struggling to get food on the table for you and your children, the choices you make, the things you have access to, they're going to be a challenge. So I would definitely prioritize those basic needs. However, I will also add mental health, because I do think that because we have so many things going on, you talked about some of the stressors earlier, some of the things that are becoming problematic for people, dealing with tragedy, dealing with violence in the community. There's still a number of people that are still dealing with the after effect and trauma from COVID. I think sometimes we forget about the immense loss that people experienced during that time.
Exactly.
So I think that mental health, I would put that very high on the priority list, because we know that there's a shortage of mental health. We know that about 40% of people who need mental health services don't access it, or don't have access to it. Probably more. And so we want to make sure that people have access to mental health services. So if we had more of that support, then people may be stronger, may be more capable of thinking about some of the other things that are on your list, thinking about substance abuse and getting treatment and help for that, thinking about ways to identify employment that can help them become more stable, or different things that mental health has an impact on. So,
well, that's good. So now we've talked about it, we've identified, we've kind of, narrowed down the impact of unhealthy living versus healthy living, and access to improving those. Let's talk about the solution, because right now people think, okay, well, we can, from a business standpoint, and I say this as a business owner, we can impact some of this mental health if we just bring people back into the office to work, right? Because like you said, the impact of COVID is still present. So let's bring them back into the office, because from a financial standpoint, we don't want to pay rent and space for a place that's empty. And so we want to honor our contracts, so we need to make people come in. But the people that are working from home says, I can get more done because I can monitor my kids, I can cook, I can clean while I still work and be more productive. So now we have that going on. So as far as finding solutions, that's a financial solution that some people think is relevant, but I don't know if I'm going to eat healthier at home or at work on a lunch break, or if I'm going to do more exercise at home, or if I come into the office, and even if the office has some kind of plan where you walk around or whatever. So I don't know if that is an example of a solution that gets us to a healthier and more productive community.
Right.
So let's discuss this area of improvement. What issue do you think, if we fix it or address it, will have a positive impact on the health and wellness of our community?
You know, I want to go back to something that you mentioned just a minute ago about bringing people back to work, because I do think that's always a challenge. That's something that we hear a lot about, a lot of conversation. And I think we have to remember that it does cost to go to work. It costs time. It costs money. It costs additional daycare and a number of things. And so I think, you know, as we think about returning people back into the office space, we want to make sure that we're also keeping in mind the cost related to that transition, especially as people are balancing, their income, and, some people are losing jobs and things like that. So we want to kind of keep those things in mind.
Now, do you pause right there? Do you think that bringing them back in is going to have a negative impact or more of a positive impact in the long run?
I'm not sure. That I can't really answer that. I think it depends. It depends on the kind of employment. It depends on the distance that people travel to work. It depends on the environment at work. I've known a number of people lately, especially, who have gone back to work, and their emotional wellness, their stress levels are actually higher because some of the things that they're experiencing in that return to work aren't what they were prior. And so there may be some stressors there. Also, just trying to rebalance the lifestyle that you made, recognizing that I can get up at 6 o'clock in the morning, start working at 7 o'clock, shut down at 4 o'clock, and I'm ready to, take care of the rest of the household and the children and all of that. Having to rebalance those things could cause stress. And as we talk about mental health, that could be another stressor on people, especially if you're talking about single parents, if you're talking about people with lacking resources, if you're talking about people who have other challenges, that could be a factor. So that's something that I think we can keep in mind, especially if we think about mental and emotional wellness. Those could be concerns. But that doesn't say that people shouldn't go back to work, right? As you mentioned, there are benefits. There are the socialization. We know that loneliness is a huge issue for a number of people, especially during COVID. People were isolated. So going back to work for some people could be a benefit. It could be, reconnecting them and re-socializing people, and those things could be a benefit.
So the one positive impact, one positive change that we could make that would improve the health and wellness of just the community, what would you identify that as?
So we talked about a lot of different issues, and I feel like I'm sort of there. There's so many things that we could, think about. But I do think that making sure people have access to health care in an equitable way. And when I say access to health care, I'm talking about having insurance, having facilities for health care that are close to you in your neighborhood, in your community. But we're also talking about equitable access to health care. So whether I get health care in North Atlanta or South Atlanta or East Atlanta, the quality of the care that I get should be equitable. So I shouldn't have better chances of being healthy because I live on the north side. One of the things we know is zip code, for example, is a huge predictor of people's health outcomes. And so even when we talk about some of these different services and things that are available, when we think about transportation issues, when we think about housing issues, they're all different depending on where you live, what part of the city you're in. The quality of those things is different. So if there was one thing that I think Atlanta and many places could do to really strengthen people's ability to be healthy, is to ensure equitable access to health care.
What's the one thing that you think that we can do in our community to change the physical environment? We talked about various, we didn't talk about food deserts, but there is a lack of, you did say a lack of certain food choices in certain areas, and based on economic abilities or whatever, that affects how healthy you eat or don't eat. But what change can we make in the physical environment? We talked about putting more health facilities. We got that. So,
I think we also want to think about safety, public safety in general. Again, I think all of these things are cyclical, right? They all sort of connect. So even if we have the facilities available, again, the community itself, thinking about the safety of getting there. I live in a part of the city that we're just starting to really invest in sidewalks, for example. Well, if I have to walk somewhere, is it safe for me to walk along the street? So thinking about having sidewalks, something as simple as a sidewalk, or thinking about making sure there's public transportation and access. How do I get to the places that are there? One of the things we are seeing, we talked about more clinics and facilities and hospitals and things like that. We're seeing a lot more community-based hospitals. People are really seeking outpatient care, not necessarily inpatient care. I want to be able to go get my examinations, get my tests, get these things done. But do I need to go to a hospital to do it? Do I need to stay overnight? We see a lot more outpatient need from communities. So making sure we're having facilities in community where people can actually access the care. That goes for testing, screening, appointments, everything. So I think all of these systems are connected. And we talked about housing, and I just want to stress again the importance of affordable housing.
So how can people reach you or reach your agencies for assistance or collaboration?
Sure. So I work with Emory University. So our center is called the Emory Centers for Public Health Training and Technical Assistance. So if anyone is working with a community-based organization or a health department and would like to strengthen their community partnerships, would like to learn more about how to really engage their community and address some of these issues, look up Emory Centers for Public Health Training and Technical Assistance. You can Google it. It'll take you directly to our website, and you can see all of our different technical assistance and training programs that are available.
Thank you so much for coming and being with us today, Neighbor Bankhead. We call everybody neighbors because we're just like in the community together. So what I want to say is I hope that our community will join us next time as we continue our conversations, because we know when neighbors talk, locals listen. I'm Dana Tucker Davis, and I hope to see you next time.